Now, from a lack of access to medical resources to racial disparities in treatment, marginalized communities in America face staggering inequities in healthcare. Last week, the American Medical Association pledged to tackle the inequities in healthcare, declaring racism an urgent public health threat. The new policy aims at confronting systemic racism, racial injustice, and police brutality in America. And joining us to discuss how this new policy will change how the country approaches health care is Dr. Willard Edwards. Dr. Edwards, thank you so much for joining us. Dr. Edwards is a member of the Board of Trustees of the American Medical Association. So, Dr. Edwards, to start, racial justice, racial inequity rather, is not a new topic to be discussed in healthcare. What pushed the American Medical Association to take this step to designate racism as an urgent threat to public health?
Well, we're looking at racism of any kind, whether we're talking about systemic, cultural, or interpersonal. We recognize that it threatens public health and the advancement of health equity, and it's a barrier to appropriate medical care. In this past June, our Board of Trustees acknowledged the health consequences of violence, police interactions, and denounced racism as an urgent threat to public health. And we did pledge action to confront systemic racism, racial injustice, and police brutality. So our House of Delegates met and we passed a policy that stating that racism as a public health threat. And we also acknowledged in that policy passage was the fact that harm has been caused by racism and unconscious bias within the healthcare system, examples of which are more C-sections in minorities, more maternal and infant deaths in minorities, as well as less pain medication being given to our Black and brown kids relative to others. And we also wanted to encourage more medical education curriculum such that our medical students and our practicing physicians learn to promote greater understanding with respect to how this public health threat can influence our medical decisions that are made by way of unconscious bias.
You know what? When you talk about how these are made by way of unconscious bias, I would imagine that a large level of education first on educating people what unconscious bias is. Some people really don't know, yes, and they haven't been confronted, yes, with this in their lives. So how does the AMA, yes, propose doing this? Simply educating people who are not aware of their own unconscious biases, or even that it might even exist, unconscious bias in general?
It's absolutely necessary for people to get training in that area, and we are encouraging people to get that whatever means they can get it. Because we do realize that it's the unconscious bias that has been underlying our healthcare system and creating more health disparities with respect to the disproportionate impact that communities of color have with COVID, as well as other chronic diseases, whether you're talking about diabetes, hypertension, or kidney failure or cardiovascular disease. And we're looking to see how not just our medical community can impact this racism as a way of, as we said, as a public health threat, but also looking at other communities that can help us. One example is in Chicago. We have on the west side of Chicago, it's called West Side United in Chicago, in which we want to see this replicated in other communities across the country. The AMA has invested $2 million into a community development effort, and they're trying to narrow the 17-year life expectancy gap between neighborhoods that are low income versus the neighborhoods that are more affluent in the downtown area of Chicago. And how they're doing that is by improving access to affordable housing, access to healthy foods, and also investing in and financing neighborhood business projects, and also supporting job creation and and just education in general. By doing that, by declaring this racism a public health threat, we're moving closer to reaching a health equity, which we define as optimal health for all, while creating a path towards truth, healing, and reconciliation.
Okay. Now, doctor, help us with some of the issues in healthcare that this new policy will address directly. I think many people have heard of possible different ways people of color may be treated in emergency rooms, or even maybe women, how women are treated in delivery rooms. But can you share some of the specific ways that you guys will address this in the new policy?
Certainly, we have resources online, just as we have information online about how people can address the health pandemic that we're in right now, we all know is COVID, as well as teaching people about how to address the unconscious bias. We're all in the AMA within ourselves. You don't just put this forward by just saying that you're perfect. We're not perfect within the AMA ourselves. And so we have resources for our physicians, for our medical students to be able to do bias training, the unconscious bias training in the medical schools and across the country. We want to make sure that people look from within and then see how they might need to change their habits and what they have done before. We have what we call the fact that there's this racial essentialism where we may sometimes present a case where we say this patient is an African-American woman who has such. That then impacts how we make our decisions about the care of the patient, as opposed to just saying this is a 37-year-old female and this is how this patient presents. And then it gets us more thinking about the fact that race is a social construct as opposed to a biologic. That's another one of our policies that we passed as well. And we're going to be educating all of our doctors across America with respect to that.
Dr. Edwards, thank you so much for joining us. I'd be interested in seeing just how these efforts progress in the next few years.
The biggest stories the moment they happen from around the globe. Subscribe to Bloomberg Quick Take now for insight in an instant.